Hi everyone, I'm Julia. This is Gemma and Giorgi and Kahlia. We are all third year dermal therapy students and working in the industry in a variety of different beauty and dermal related settings. In this line of work, we are constantly faced with challenges prior to treatment, during and post treatments. To minimise the risk of these challenges arising, documentation and more specifically record keeping are imperative. Client records are essential in ensuring high levels of client care for the protection of the practitioner to facilitate effective treatment and by minimising exposure to litigation. Good clinical documentation assists best practice in client care by ensuring that important client information is available to all treating and consulting practitioners, continuity of care is possible between practitioners over time and between different health services. The client record should include all personal details, signed consent forms, treatment plans and records. The patient information should not just be a memory aid for the individual clinician who created it. The report should allow other therapists to read and quickly understand the client's information, history, and treatments. Today for our group assignment, our topic is record keeping and what can go wrong if you don't keep proper records. With an increased number of physicians and non-physicians utilising cosmetic laser modalities, the risk of inadequate record keeping and consequential legalities exist. In the first scene, negligence is seen through the improper use of documentation and record keeping. Professional negligence refers to the failure to provide an adequate level of care to the patient. As previously discussed, the consequences of inadequate record keeping can result in a multitude of complications for the therapist, patient, and business.
By the first therapist failing to keep record of parameters used along with client consultation documentation, the second therapist is then unaware of what has previously been achieved during prior sessions. Patient profiles are the predominant source of information regarding an overview of general health with essential information such as medications and medical conditions listed. Failing to keep these records results in information being unobserved with increased risks of complications arising. The Good Medical Practice Code of Conduct 8.4 defines record keeping as keeping an accurate, up-to-date and legible records that report relevant details of clinical history, clinical findings, investigations, information given to patients, medications and other management. Failure to keep records and documentation leads to the following risks: injuring the client unintentionally, resulting in burns, blisters, hyper and hypopigmentation. Failing to keep records also affects the business as a whole, resulting in audit failures, external audits, failing to provide documentation, leading to fines along with possible closure of business, with possible charges and offence under the State Records Act 2000 for failing to comply with record keeping. Criminal penalties for employees for failing to provide documentation of current licences and certificates, enabling the employee to perform these treatments, which comes under Falsifying Documentation, Crimes Act 1958, Section 83. Employee and business lawsuits. If a client provides false information, failing to reveal health conditions and medications, this can result in a reaction to the treatment. Providing proof of these records, such as client cards and written statements, ensures the employee and the clinic have the information and documentation present in the event of an attempted lawsuit.
In a clinical or healthcare setting, an incident report or accident report is a form that is filled out in order to record details of an unusual event that occurs at the facility, such as a negative skin reaction or injury to a patient. In the first scene, the therapist not only failed to fulfill her duty of care through appropriate consultation and record keeping, but failed to file a report of the hyperpigmentation and burns that occurred on her during the treatment on her client. Within an incident report, the following The following information should be included: date and time, place of incident, full names of all parties, involved area and treatment details, the injury that occurred, action taken by clinician in response to injury, further recommendations, any witnesses to the event, and any additional information that is relevant, including machine and equipment used. Current research shows that appropriate record keeping can provide important and essential information about patients' medical history, future management plans, and information that can affect treatment efficacy and safety. The move towards electronic versus paper records has the potential to enhance communication between not only dermal clinicians, but encourage accessibility over multiple clinics and encourage multi-professional practice. Patient records is a communication tool that supports clinical decision-making, coordination of services, evaluation of the quantity and efficacy of care, research, legal protection and education, and accreditation and regulatory processes. In the past and currently, many clinics continue to utilize paper records. However, the way of the future and direction in which many practices are headed is towards electronic paperless records. Some of the issues and limitations faced by workplaces around paper records include: they are often kept at the initial visit and the clinic that occurs at. If the business operates from more than one location, the patient's file is not then accessible from other venues. There's a lack of security. In chronological order, it may be difficult, as maintaining that order with paper is often difficult. Often illegible, as well, as people are rushing to finish the time of, they're struggling to finish due to time constraints. Information can often get lost or be destroyed, and there's a cost associated with paper and printing.
In contrast to paper records, the ease of accessibility of electronic records is much greater. Updating existing records, creating new ones, and accessing data from other clinics is achievable. There are a few ethical priorities surrounding the use of electronic records and whether or not they are appropriate in areas such as privacy and confidentiality, security and integrity, and availability. Privacy is centered around the collection of information, whereas confidentiality is communication of information. Information shared between the clinician and patient must always remain private and confidential. Patient information should be released to others only with the patient's permission or as followed by law. The Good Medical Practice 2014 Code of Conduct 3.4 states, patients have a right to expect that doctors and their staff will hold information about them in confidence unless release of information is required by law or public interest considerations. The Health Records Act 2011 Code 1.7 states, if personal information is given in confidence to a health service provider about an individual by a person other than the individual or a health service provider in the course of or otherwise in relation to the provision of health services to the individual, with a request that the information not be communicated to the individual to whom it relates, the provider must confirm with the person that the information is to remain confidential, and if the information remains confidential, record the information only if it is relevant to the provision of health services or to the care of the individual, and take reasonable steps to ensure that the information is accurate and not misleading, and take reasonable steps to record that the information is given in confidence and is to remain confidential. The key to preserving confidentiality is to ensure only authorised individuals have access to information. Extensive security measures, including training and policies and procedures surrounding information, are imperative to securing patient information. The increased use of mobile devices has become an area of concern for security breaches of information. Small devices may become lost or stolen more easily than computer workstations. The use of small portable electronic devices for confidential information should be kept to a minimum. It is essential that all electronic private information is protected by firewalls, antivirus, and intrusion software. A full security program must be in place to maintain the integrity of the data. In addition to the importance of privacy, confidentiality, and security, electronic records must address the integrity and availability of information. Integrity assures that the data is accurate and has not been changed. This will reduce the chance of errors. Ensuring the clinic utilizes an appropriate data collection and management system is key. Availability allows individuals to access records from all clinics and allows for ease of use. However, clinics must remember to always log out of programs and backup information so it is not vulnerable to hacking. Overall, correct record keeping is essential for not only the business aspect but also for the safety of clientele. Accurate records are required to ensure the best quality service is provided each time a client enters the clinic, minimizing risks and protecting employees from legal action if risks were to occur. Thank you.